Good morning. Today we will talk about hypertension. Hypertension is basically high blood pressure. Hypertension, the silent killer. So, the leading cause of death in 2021 was hypertension. So, what is the average blood pressure that you should aim for? Average blood pressure is around 120 over 80. Now, this is not the latest goal from the American Heart Association. They may have a lower goal for your blood pressure. However, it's debatable because if you had a stroke and you're seeing a neurologist, sometimes a neurologist may want a higher blood pressure just so that your brain can get some blood circulation. Also, elderly people tend to have labile blood pressure because of possible dehydration. So sometimes the doctor may want an elderly person to have a little higher blood pressure. But basically, if you're young, you can have a blood pressure less than 120 over 80. A blood pressure that is dangerously low may be 99 over 59 or less. You may feel lightheaded, dizzy, faint. You can try to drink water to see if that will increase it. If not, call 911 for emergency. A high blood pressure is 140 over 90. So you should see your doctor because it puts you at risk for heart attack and stroke when you have a blood pressure that high. Now, the risk factors for hypertension: age, sex, heredity, stress, diet, illness, activity level, tobacco use, caffeine use, substance abuse, pregnancy. So, prevention is the key. You want to prevent hypertension. So, you can't change your age. You can't change your genetic sex. You can change your phenotype. You can't change your heredity. You probably can't change pregnancy either. So you can change your diet. You can change your activity level by exercise and increasing your activity level. You can stop smoking. You can reduce caffeinated beverages. Substance abuse, that's obvious. You don't need that at all, actually. Illnesses, you may or may not be able to reduce the illness. It just depends on what it is. So, the best way to control hypertension is to prevent it as much as you can. But there are some factors such as age, sex, and heredity that you'll be unable to change. Okay, so related health conditions: essential hypertension, which is basically just high blood pressure that's not caused by anything else except essentially high blood pressure. heart failure, which heart failure can actually give you a low blood pressure, but you can do damage to the heart by high blood pressure. So it is related. And also, you use some of the same medications for heart failure that you would use for hypertension. Some of them are similar. Stroke, heart attack, angina, or I used to call it angina, but some people say angina. Okay, kidney disease, because high blood pressure can cause kidney failure and need for dialysis. Decreased vision, you have small blood vessels in your eyes that can blow with the high blood pressure. Hyperlipidemia, which is high cholesterol, that could clog up your arteries and cause hypertension. CAD, which is coronary artery disease, that's the blood vessels that feed the heart. PAD, which is peripheral artery disease, that's the blood vessels that feed your extremities or your arms and your legs. AFib, which is atrial fibrillation. That's when you have an irregular heartbeat, sometimes like a heart flutter, the blood won't pass through the heart the way it should. It could also cause blood clots and strokes and heart attacks. Okay, so angina. Angina is basically chest pain. So if you have acute chest pain, meaning it just started, you should call 911 to make sure that you're not having a heart attack. Now, some people have something called chronic angina, which means they have chest pain all the time because they have CAD or some other issue with the heart, like the valves or something. But most of the time, it's from a problem with the blood vessels that feed the heart. And so when they do activity like walking, running, jogging, their heart cannot get enough oxygenated blood. So it will cause chest pain, which they call angina. So usually when they experience the chest pain, they will take a medication called nitroglycerin under the tongue, or nitro. It's said after you take the second nitro, you should call 911 because that possibly means it's not working and you may need medical attention. You can take up to 3 nitro for chest pain. The side effects of nitro is it can lower your blood pressure, so you probably want to sit down when you take it so you don't, faint or pass out, and check your blood pressure. So when you have angina, when you do activity, your heart may not have enough oxygen and it may cause the pain. It's like a part of your heart is actually dead or not getting enough blood flow. So the nitroglycerin will open up those blood vessels to the heart to let the blood get through, to feed your heart. These blood vessels to the heart could be clogged up from high cholesterol, or possibly it could be a hereditary issue. Okay, stroke. So there are 2 different types of strokes. there is ischemic stroke and hemorrhagic stroke. So when you have an ischemic stroke, it just means that your brain is not getting enough oxygenated blood. It could be a blood vessel in your brain that's clogged with cholesterol or a blood clot. So aspirin could help this. However, if you have a hemorrhagic stroke, aspirin would make that worse because it would cause more bleeding. This is a medical emergency. And so, actually, I feel like a stroke is actually worse than a heart attack because with a heart attack, it doesn't really leave you paralyzed or blind in one eye. It probably won't change your life. Like if you have a heart attack, it's not going to affect your speech. It's not going to affect your mobility. But with a stroke, it can make you blind in one eye, paralyzed on one side, inability to swallow, inability to speak. It may also cause inability for you to eat because you may not be able to swallow because the muscles in the throat may be weak. It could cause you not to be able to drive anymore because of the paralysis. You may not be able to work anymore. It may change your life. It may put you in like a care home or something like that. So you definitely want to prevent stroke with low cholesterol diet. You want to, whatever risk you have of having a stroke, like if you have atrial fibrillation, you want to treat that because that could cause blood clots. They treat that with blood thinners. If you have high cholesterol, you want to lower that. If you have high blood pressure that puts stress on the blood vessels, you want to lower your blood pressure. You want to see your doctor to reduce your risk of having a heart attack or a stroke. Okay, so let's talk about heart failure. So actually, heart failure, usually you don't have high blood pressure with heart failure. You usually have low blood pressure with heart failure. And the reason why is because your heart is failing. It's not able to do its job. It's not able to pump all the blood or fluid around your body. So fluid starts backing up. You may gain fluid in your lower legs or in your abdomen, depending on what part of the heart is damaged. There could be a valve in the heart that's damaged, that's not working correctly. The actual heart muscle itself could be damaged and not working correctly. The heart may not be beating correctly. So the heart can become enlarged because it's working so hard. The muscles can thicken up and it can fill up with fluid. And so some of the symptoms of heart failure is fluid gain, excess fluid, fatigue, and shortness of breath, especially when walking. If you have to put like 3 pillows under you at night so you can breathe, that's sometimes a sign. Because if you have a lot of fluid in your abdomen, your lungs cannot expand like they normally would, and it could cause shortness of breath. So definitely, see your doctor to have your heart checked. Now, some of the medicines to treat heart failure are medications like digoxin, metoprolol, amlodipine, some fluid pills, furosemide, spironolactone, different they usually use medications that will slow your heartbeat down, so you'll get a more effective heart pump to push that blood around the body, and also to get rid of some of that fluid so your heart won't have to work so hard and wear itself out. Okay, so I thought it would be nice if I started adding women's health into the education, just because in 2024, women's health has really gone down in America. So I think I'll start, you know, entering, mentioning women's health to hopefully make things better for women and their health in America. Okay, so this is about heart failure and pregnancy. So I'm going to tell a true story, actually. Of course, I can't give the names or anything like that, but it's a true story, so you could say it's a story time. Okay, so there was a young lady. Of course, this is many years ago. This is like 40 years ago. And then I met her like 20 years ago. Or it could be longer. So, anyway, she had a child. She had a husband and she had a child, and she wanted to have another baby. Her doctor told her, "You have heart failure. You cannot have another baby because it will kill you. Your heart is not strong enough to have another baby." Now, she happened to be a twin, which is very interesting. So her twin died in childhood, and her twin died from a bad heart. They were born with bad hearts. So this issue was hereditary. Um, so she did not follow the doctor's advice, and she wanted to have a second baby. She got pregnant against the doctor's advice. Okay, so her heart, she did have the baby successfully, and it did, of course, progress her heart failure even more. So she had a pacemaker put in, um, and of course, she had to take medications. It was a very difficult recovery for her. Uh, she was in ICU. She went home, and I'm not sure if she was compliant with her medications, because she used to ask all the time, "Do I have to continue taking medication even after I had surgery?" And of course, the answer was yes. You still have to take your diuretics to get rid of the fluid. You still have to take, your medications to help your heart to beat better, to circulate the blood and the fluid around your body. Well, I'm not sure if she was taking her medicines correctly or not, but her family ended up calling 911, and 911 came. And when 911 got there, she had so much fluid in her body from the heart failure that the fluid was even draining out of her ears. Now, that's the most serious case of heart failure I have ever heard of in my life. I'll be honest. I never heard of someone filling up with so much fluid that the fluid drained out of their ears. That is very severe. But anyway, she was able to live with her children. I think the oldest one was 18, and the second one maybe made it to 14. But during her pregnancy, her heart failure did get, much worse. Okay, so I hope that helps someone. So that's the story on a women's health case with pregnancy and heart failure. Okay, so you do have to, I guess you don't have to follow your doctor's advice, but I think it's much better to get advised by a doctor that has gone to medical school than to get advised by, judges, lawyers, representatives that have no medical training or background. And that's all I'm going to say about that. Okay, so now let's talk about the treatment for hypertension. So you can treat hypertension with diet, exercise, stress reduction, and medication. So you always want to prevent hypertension. So you would use 1, 2 through 3 first. And then if that doesn't work to prevent hypertension, then of course you will need medication to reduce your risk of having a heart attack or a stroke, which can cause death. Okay, so let's talk about the diet. What kind of diet do you need to be on to prevent or treat hypertension? So, this is the DASH diet. And I forgot what DASH stands for. I think it's diet associated to stop hypertension. I doubt that's what it is. But anyway, you can look it up on the government website, and you'll find it. It's called DASH diet. So basically, it's a Mediterranean diet, it's a low fat diet, and a low salt diet. So they promote grains and wheats, fruits, and vegetables. The good cholesterols are the ones, or the good fats rather, are the ones that are liquid at room temperature, like your olive oils and your vegetable oils. Try not to eat the butter sticks or the margarine sticks or the oils that are solid at room temperature. Also, avocado is a good fat, nuts are a good fat, fish is a good fat. I think that's similar to the omega oil or the fish oil tablets that help with triglycerides, I think. So you want to reduce your salt to less than 2 grams of salt per day. That would be considered a low salt diet, not regular salt, but low salt. And so that would be about less than a teaspoon of salt every day. And your body needs some salt, so you don't want to get rid of salt altogether. Salt grabs water, so it can control your blood pressure by controlling water. You know that the more water you have in the body, the harder your heart has to work to pump that fluid around, and it can raise your blood pressure. So it all works together, but you do need some salt, especially if you were exercising or going hiking. They always advise like a salty snack with water because you need that. And people in sports, they usually drink Gatorade to replace the electrolytes that they would lose while they're sweating. Okay, so the medications. So, if diet and exercise doesn't work to treat or prevent hypertension, your doctor may want to put you on medication to reduce your risk of having a heart attack or a stroke and prevent death. So, basically, sometimes the medications may not work for you. So, there's so many medications on the market, so if the medication is not working for you, go back to your doctor to have a different medication. So, some side effects that I see sometimes is low blood pressure. That could happen with any medication. So, sometimes if your blood pressure is too low, your doctor may want to reduce your medication. A low blood pressure could cause you to faint or pass out, and so it could be dangerous. Another side effect that I've seen is a cough. There are some blood pressure medicines that can make you just continuously cough, and I think that was the lisinopril medication, if I'm not mistaken. So if you have a chronic cough on blood pressure medicine, get it checked out with your doctor. Also, amlodipine is a very good medication to prevent heart failure. It works very well, especially with black people, to prevent heart failure. But the side effect with amlodipine tends to be swelling in the ankles or the lower extremities. So you could try to elevate your legs, and if it goes away, that's fine. If it doesn't go away, then see your doctor because they'll have to put you on a different medication. Also, there are some medications that can cause angioedema or a lot of swelling in the face, the lips, around the throat. That could be dangerous. So go to your doctor if your lips swell up with a new medication. Also, some of the fluid pills can cause low potassium, so your doctor may want to put you on a potassium replacement if you're on certain medications like hydrochlorothiazide or furosemide or other fluid pills. So that's just some of the side effects, but any medication could have a side effect. So you have to weigh the advantages over the disadvantages. So the advantage would be preventing a heart attack or a stroke. So just go see your doctor if you have any side effects so that they can adjust your medications so that you can live a long and healthy life. Okay, so frequently asked questions. I get this question all the time. I mean, so many times it's like, I'm just saying, are they going to ask? Are they going to ask? I'm just waiting for them to ask this question. Okay, so the most frequent question that I get is, if I diet and exercise, can I stop taking my medication? Wow. To be honest, nobody can answer this question because everybody's health journey and health issue is different. So I can only answer this question to the best of my knowledge. And I would just say most of the time, let's say 95 to 98% of the time, no. Because whatever damage that you had in your body that caused you to have hypertension was probably not really resolved with just taking the medication. I mean, the medication probably just helped to control it. So, like, if you have a little issue with an irregular heartbeat or AFib, um, the usually you take blood thinners and a medication to control your heartbeat. If you stop taking the medicine, most likely that irregular heartbeat is not cured, right? It's probably going to come back. Um, Also, if you have like a heart failure, it's probably not cured. It's just, controlled with the medication. So usually the doctors will tell you that if your blood pressure is normal on medication, that just means your medication is working. Now, there is a circumstance when the doctor may stop your medication, and that would be if your blood pressure is too low. So, if you're dieting and exercising and your blood pressure is too low, then at that time, your doctor would start removing some medications. So, I hope that helps to put that in perspective. And depending on what your health issue is, by stopping your medications, you could actually make the condition get worse. And so be careful with that and talk to your doctor before you decide to discontinue your medications. Okay, so I hope that this information helps you to either prevent or manage your hypertension. Thank you and be blessed.